In the last 24 hours, Zambia has recorded 244 new COVID-19 cases out of 6,238 tests conducted. Of the positive samples, 187 were collected within the last 24 to 72 hours, while 57 were older than 72 hours. Following the reduction in positivity and admissions, the Ministry of Health says it has begun to reduce the number of staff that are stationed in COVID-19 isolation facilities. Permanent Secretary for Technical Services, Dr. Malama, says this is in a bid to strengthen service delivery of other health burdens.
As we fight COVID-19, we are alive to the fact that Zambia still faces disease burden from HIV and AIDS, malaria, tuberculosis, non-communicable diseases, and indeed challenges related to reproductive, maternal, newborn, child, adolescent health, and nutrition.
Dr. Malama says all is set for the procurement of a new oxygen plant to be set up in Kitwe. Valued at about $1 million United States dollars, the project will be carried out with support from the United Nations family.
UNICEF has approved, supported by other stakeholders, has approved to the procurement of an oxygen plant to be installed at Kitwe Teaching Hospital. UNICEF, supported by FIDA Sweden, to place them even in the rural and the remote parts of our country and assure availability of oxygen in those particular facilities.
Meanwhile, 2,116 COVID-19 cases remain active, with 2,000 in home isolation and 116 in COVID facilities. Of the 116, 83 are on oxygen therapy while 25 in intensive care unit. Director Infectious Diseases Professor Lloyd Mulenga says the number of critically ill patients is high, such that a waiting list has now been created for patients going into the intensive care unit.
Critical patients, today we have 20% of those admitted are critical. And I think previously I said the past 2 weeks, remember, where we have had even a waiting list into ICU. The patients are staying longer. Yesterday, I saw one of the longest patients who has been in the facility for 3 months. When you have patients staying long in ICU, it means those who are coming, you don't have spaces where you have to put them. And this has been the major troubling thing with this wave, with the second wave. In the first wave, they were staying shorter periods in ICU. We discharge them. But also one thing is which I've seen is the outcomes are better now. I think our staff have become more experienced. We've put in also a lot of nursing care as well, a lot of doctors, both infectious disease doctors, internal medicine doctors.
Virginia Chilongo, Movie TV News, Lusaka.